Welcome to the Aging Well podcast, where we explore the science and strategies behind living a longer, healthier, and more fulfilling life. Today, I am excited to welcome Dr. Julian R. Gershon, Jr., a triple board-certified physician in family medicine, sports medicine, and anti-aging and regenerative medicine. As the founder of the Aspen Institute, Dr. Gershon specializes in cutting-edge treatments like hormone optimization, stem cell therapy, PRP, and peptides, helping individuals unlock their full health potential. He is also the author of Beyond the Fountain of Youth, where he shares groundbreaking insights on anti-aging therapies and practical longevity strategies. In this episode, we'll dive into the science of regenerative medicine, explore how personalized treatments can enhance vitality and performance at any age, and discuss actionable steps to improve overall well-being. Get ready for an enlightening conversation on how to maximize your health span and age well. Dr. Gershon, welcome to the Aging Well podcast. Let's just start by having you share a little bit about yourself and why you found it so difficult to settle on just one specialty in medicine.
Well, that's a great topic. It's a pleasure being here, and I think that I've always, just been motivated to learn more. And I started being board certified in family medicine. I've been involved in sports medicine since I started practice in 1980, and helped actually write the first board certification exams for the American Osteopathic Academy of Sports Medicine. Back then, it was called a Certificate of Competency. And then as that grew, it became board certification of adequate qualification. And so I sat on the board of our Sports Medicine Academy for 11 years, actually. And then as I became an aging athlete, and of course I did a lot in sports medicine. I was lucky enough to serve on several different Olympic teams, from judo to freestyle skiing. I got to go to the 96 Olympics as a physician for the U.S. judo team. And then I was a team physician at the University of North Texas for 20 years before moving to Aspen in 2010. I grew up ski racing, and so my passion to be out here has been since like age 12 or 13. And I just kept learning, a couple sports medicine buddies of mine, and I talk about it in the beginning of my book. In 89, I remember showing up at one of my Sports Medicine Academy board meetings, and my friend Bob Goldman, who actually was the founder of the American Academy of Anti-Aging Regenerative Medicine, Bob Goldman, and Ron Klatz, he wasn't there. And I'm like, who's seen Bob? What's going on? And they're like, well, he started some anti-aging thing. And I literally said, he's lost his mind. he's nuts. But turns out, yeah, he was a visionary, and he really, he and Bill Falloon, who wrote the intro to my book, founder of Life Extension Magazine and Life Extension Products, were the pioneers that fought the fight in the beginning. And because it's been met with great resistance for the last 20 plus years now. And so in about 2000, I ended up at a convention in Las Vegas, one of the annual world conferences of anti-aging medicine, because I just wanted to check it out. I was turning 50, and I'm like, what the heck? I feel pretty good, but it made sense. And so I've done hormone optimization personally for 22 years. I'm 72. I feel pretty darn good. I'm still very active, playing a lot more golf than skiing now, but, I love to do both. And we just got 9 inches of powder last night. So tomorrow's Saturday, I will be skiing this weekend. But so that's kind of my journey and what happened. And as I found and learned more about the benefits and how to properly optimize hormones, and learned that when done correctly, optimizing levels in the upper limits of normal, where we were in our 20s, that is very safe, and that it's the way to have the most vitality that you could ever ask for. And so testosterone therapy for men, other hormones for women, progesterone, testosterone, eventually estradiol, but they're all very safe, and they decrease our overall risk of cancer, from breast to prostate to colon to all forms of cancer, when hormones are optimized. And as opposed to the wives' tales that I still deal with. Once or twice a month, someone new, we get started, and they said, my golf buddy, who's a cardiologist, said, I'm going to have prostate cancer. Or my girlfriend said, I'm going to get breast cancer. Or my OB-GYN, which unfortunately, that other physicians that aren't as informed and don't understand the safety of natural bioidentical hormones, those thought processes are still out there, and we still have to deal with that, on a regular basis.
And I assume too, I mean, you keep using the word optimize, where I think a lot of people might be thinking when you start talking hormones, it's like the bros at the gym with the steroid injections and things like that to get excessive muscle mass. And that's not at all what we're talking about.
Well, and the audio cut out a little. I didn't hear you, but I think you were comparing to excessive use of anabolic steroids, let's say, versus what we do. And yeah, that's the case is we want our levels to be in the upper limits of normal where they were when you were 20 to 25. And for a man, that's around 1,000 or more. The free testosterone is only 1% to 2% of that. So if your testosterone is 1,000, if you're lucky and it's 2%, it's 20. Well, that's the goal. A week after a testosterone injection, I want it to be somewhere around 16 to 20 so that I know that after the injection that, and not everyone does self-injection. We use other forms of therapy, but that we're up in the 20s. And I just tell people that's where I want you to live. We want things to be optimal. How many sick 20-year-olds do you know that are tired or don't have the energy they need to work or interact with their family, etc.? And so it's a process. There's very specific numbers. Everything we do is based on laboratory data, keeping those levels in optimal, safe ranges. It doesn't do any good at all. And I talked to one of my golf buddies. I played a simulator league on Thursday afternoons. We were talking at dinner yesterday after playing, and well, yeah, I'm using a cream and this or that, and I don't know how I feel. I'm like, well, what's your blood levels? He's like, I don't know. And I know who prescribed it for him because he's a friend of mine. And I'm like, well, I'm going to give you a copy of my book next week, and you figure this out and ask him for a blood test. And because it does no good at all to dabble with it, you want to be in an optimal range. That's where we see the best results. That's where we see decreased risk of prostate cancer for men. There's multiple veterans home studies showing that those little old guys that had the highest natural levels of free testosterone had the lowest incidence of prostate cancer. And so, there's a lot of information out there. We try not to deal with wives' tales, but we have a lot of questions to answer. It's getting easier than it used to be because we're slowly becoming mainstream, but the goals are the same. And so that's where I want people, as I say, I have a page with a checklist, and the left side of the page is the words never, mild, moderate, severe. They come in, the check marks are on the right side of the page. I'm like, look, I want you to live on the left side of this page. So we're going to get there in the next few months.
That's awesome. And we talk often on this podcast about the conflict between preventative, or what I call proactive medicine, and traditional reactive medicine. And your approach doesn't really seem to fit in one versus the other per se. How do you see regenerative medicine fitting in this spectrum?
Well, I think it very strongly fits in the proactive side. It's not everyone feels bad when they come in. They may have energy loss, change. Some, I have guys in their 30s and 40s that just want to be proactive. So with them, I don't give them testosterone. We use a fertility drug called clomiphene. We use HCG, human chorionic gonadotropin, things to stimulate testosterone production. But, as somebody that's practiced for 44 years now, I got a pretty good frame of reference what it was like on the other side of the street, and we did our best. I was a sports medicine doctor. If anybody, was more aggressive about trying to help with diet and exercise besides drugs and other therapies that we used, from infections to inflammation or injuries, it's changed because now we have things like stem cell therapy, platelet-rich plasma, obviously optimizing hormones. I see a lot of subclinical hypothyroidism with low free T3 levels. And, most physicians, even most endocrinologists, if the TSH, thyroid stimulating hormone, is not high, they say, well, you're fine. Your TSH is normal. Well, I'm sorry, but the circulating active hormone is near the bottom of the scale, and they're tired. And using Synthroid, levothyroxine, is not the answer. A blend of T3 and T4 is many times over been proven now to provide better symptom relief. So I see things like that, I want to be proactive. And so I'm looking at all of those markers in the blood. When I first see someone, inflammation markers, C-reactive protein, homocysteine, cortisol, IGF-1 or insulin-like growth factor, that is what we measure for human growth hormone. And we use all kinds of peptides to improve growth hormone or actual growth hormone therapy. And so if you don't look at everything, how do you know where to go? And so from what my standpoint is a very proactive stance. Yes, I see guys that are late 40s, 50s. They've been feeling bad for a while, and it almost falls into the disease management side of traditional medicine. Well, here, let's take this, try that. Well, sure, but we've got to optimize these hormones, change things. Look at diet. Is their diet inflammatory? Are they eating tons of glyphosate in non-organic foods, microplastics? I've finally recently switched to a stainless steel water bottle on my desk instead of a plastic one because I heard Dan Pompa speak. We had a stem cell and exosome conference in Cabo 2 weekends ago, and I was shocked. I didn't realize that we eat the equivalent of a credit card worth of plastic every month.
Oh, wow.
And it's just mind-boggling.
I got to get rid of all my plastic bottles then.
Yeah. Well, and not to mention the estrogenic components in that.
Yeah.
When I started doing this 20 years ago, my average patient was mid-50s and up. As the time went on, the next decade, it was 40-year-olds. I have 3-4 dozen guys in their 30s now. Yes, there's more media attention. We see low T commercials. Oh, it could be low T. Buy this supplement. Well, not many of and I have a product I call Test-to-Boost. I do use it with some younger guys, but nothing works like stimulating testosterone production or actually using it. The supplements, unfortunately, don't work real well, but it's a big deal to address all of that.
And talking about normal ranges, do you find that in the medical profession, normal isn't always optimal? I mean, because as we age, our levels are going down. And so, of course, our levels are normal relative to everybody else that's going down as they age, but it's not necessary.
Right. Well, that is the benchmark of what I do. And I tell people right up front, look, I don't do anything normal. If your testosterone's, let's say it's 400, are you in the normal range? Yes. But if the lab says 280 to 1,000 or 1,100, let's just say 1,000 is normal. Well, you're in the normal range, you're at 400. What I say is you're in the 40th percentile. Is that how you run your business? And the answer is always, well, no, of course not. I give it 100% or 110%. I'm like, well, why wouldn't you want everything else to be in optimal levels? And so that's the benchmark for estradiol, progesterone, testosterone, growth hormone. We want it in the upper limits of normal, not the kind of levels, as you mentioned, that I won't call them.
Call them what you want.
Gym rats or whatever, guys that, and I have lots of clients and myself that like the gym, but those that for bodybuilding purposes would take high doses of testosterone, other anabolic steroids, anabol. There's a lot of names. Testosterone is an anabolic steroid, but we're not taking it in ridiculous doses. We're taking enough to see that free testosterone is around 20 or higher for most of the week. whether we're doing an injection once a week, we might use HCG on Fridays, or maybe we split the dose. I also do a lot of pellet therapy where we put little tic tacs in through a 1/4 inch incision over the hip pocket. I'm actually headed to Dallas next Thursday for a training for a new device that allows us to kind of slide them around the flanks and the love handles instead of being in the upper buttocks area. They're, I think, a little more comfortable. But it all works the same. And so we want those optimal levels. I check blood work about 4 to 6 weeks after a pellet insertion. I want the testosterone to be well above 1,000 and the free to be well into the 20s, in mid to high 20s. That's where you feel your best. And I know when mine isn't there, I'm scheduled to go get mine with a buddy of mine in actually my anatomy partner for medical school. We stumbled on each other. We hadn't seen each other in 35 years. He does my testosterone pellets for me in Denver, and he's well versed at it. And I love not having to take injections. I did self-injection for 13 years. I didn't think it was a big deal. And I didn't want to do the pellets because to me, that just sounded brutal. I'm like, that just sounds really invasive. That's all. But it is so easy. Yeah, my butt's a little sore for a few days, but it's nothing. And then as those levels climb back into the optimal range, and it stays there for close to 6 months. And so that's when you really feel your best. I do a lot. I got a handful of vitamins in the mornings, methylated B vitamins, folic acid, fish oil, things to suppress homocysteine, reduce overall inflammation. There's a long list of things that, as I say, they're just not in our food in the concentrations they should be, because even organic foods are often grown in nutrient poor soil, not nutrient dense soil. And we want to have nutrient dense food in our bodies in order to feel it. So we usually have to supplement it.
Yeah, as I was reading the book, I started to see a number of different analogies in how this all works. And, one I was thinking of, it's kind of like, a car. With the car, you're going to do your basic car maintenance. You want to use quality gasoline, put good oil in, you're maintaining the air pressure in your tires and all that. And that's the kind of that preventative side. And then the changing of the oil and fluids and things like that are a bit more regenerative. And I think also kind of like, as you talk about somebody coming into you late as opposed to early, it's kind of like a person taking a 67 Mustang and restoring it back to pristine condition. It's going to be more like it was in 1967, or you can keep that 67 quality throughout the lifetime of the car. And then we get into traditional medicine being a little bit more like, the repairing the damaged parts, waiting until something breaks on the car.
Right. We want to put some high octane jet fuel in that Mustang.
There you
Actually,
go.
I have a 64 Corvette that I've
I'm jealous.
wanted my whole life, and I baby that thing, and it gets the best care.
Yeah. So how has your approach to health and longevity evolved over all these years? I shouldn't say it like that. It's like saying you're really old, because you look a lot younger than you say you are.
Yeah, well, thanks. Um, I've always been proactive as a sports medicine physician. Diet, exercise, all the things that we can do to perform at your peak, to feel your best, nutrition, vitamins, proper eating. But it's easy to slide away from that. Yeah, I'm having a little fast food. Well, what's it cooked in? Canola oil? Why don't you just drink some motor oil? It's that bad. So, there's a lot of information out there now. I got to meet Ben Azadi in his book. He's authored Keto Flax, Keto Camp. He has a new book coming out. We're visited for a while at this conference in Cabo, and I gave him a copy of my book. He'll be on my podcast soon. But I found it fascinating to I've known somewhat about keto, but I haven't been a keto expert in the past. What I found interesting in the past, that people on a ketogenic diet eating meat, sausage, bacon, maybe some vegetables, but no carbs, their cholesterol went down. Now, why is that? And sometimes it goes up. He told me his was as high as 300 about 8 weeks into starting this, and he lost 70 some pounds. And metabolically turning things back on and allowing your body to burn fat for fuel versus sugar and stored carbohydrates can be, a very dramatic change in people and their energy levels and such. But um, I think whether it's strict keto or as his new book, Keto Flex, is somewhat flexible, limited carbs, I think, as I say, sugar and carbs are the devil. We get so much in the American diet that it's no wonder, type 2 diabetes is really an epidemic proportion. And they gave some statistics on youth in America and adult onset diabetes as early as ages 10 and 12. Well, that's our fault. That's from, leading the horse to the wrong trough, if you will. And so I'm kind of rambling. I'm not sure where I remember where we're going with this, but being proactive and, addressing everything from diet and exercise and lifestyle, not smoking and not abusing alcohol, a little glass of wine now and then, but, you can't have, 3 martinis every night and expect your liver to stick around with you. Fatty infiltration of the liver. I never used to see that 20 years ago. I didn't even know what it was until, the last decade. And it's terrible how often we see fatty infiltration of the liver. It's not just from cholesterol. We've been eating toxic foods for our lifetime. It's going to accumulate somewhere. And it's time to detoxify yourself, to get away from the microplastics, to get away from the glyphosate and herbicides and eat healthy food and fuel and replenish your hormones. If you're in your 30s and you don't feel right, but you're like, oh, it can't be that. Well, yeah, it might be. You need to see someone that can do the right blood tests for you and see where you stand. And if everything's fine, great. Check it again next year or the year after.
Yeah, I've been in a position since I teach exercise science, I have been quite more hesitant to kind of go the hormone replacement therapy or any of those kind of optimization kind of protocols because I want my students to see, this is how if you live right, you're going to function well and your bodies are going to be healthy and everything else. And I can outlift most of my students. I think my body composition is probably in the lower percentile of the class because it's got some football players in there. So that beefs it up a little bit. But, the more I look into this stuff, and especially after reading your book prior to this interview, it's like, okay, I might have to rethink that because, they know I'm doing everything right, but you can do more. And why not do more?
Yeah. And as I said, with younger guys, and I have guys that come in at they're still 50, which to me is fairly young, that testosterone's not, let's say it's 500 or 600, but the free testosterone's 10 or 8. It needs to be in the 20s. So those guys need help because they don't feel good. The checklists are on the right side of the page. Fatigue, libido, energy level, brain fog, mental focus, joint stiffness, all the things that are checked on the wrong spot. Well, what could it be from? I really believe that low testosterone in men is an epidemic. Joseph Mercola has written about it and lists all the compounds, the plastic water bottles, Teflon cookware, all the things that have BPA and estrogenic compounds in them and that have affected our masculinity across the board. I never used to see 30-year-olds. I have 4 dozen of them now. And so we do things to stimulate testosterone production. So for the guys that's 40 or 50 and testosterone's quote normal, but not optimal, I start with clomiphene, 50 milligram capsule 3 times a week, Monday, Wednesday, Friday, to have them do a couple of injections of HCG, 1,000 units of human chorionic gonadotropin, let's say Monday or Thursday. And in the vast majority, it works well. Their testosterone's back up over 1,000. Their free testosterone is 18, 20 plus a couple days after when I test it. So I know that as soon as they take it, they're in the 20s and they feel different. They feel much different. And the less, as our hormones decline, inflammation markers increase. And so do we really want to be walking around full of inflammatory proteins? That's why we avoid gluten. It's an inflammatory protein. So diet matters, but we need to decrease overall inflammation. Yes, fish oil and methylated B vitamins and folate to reduce homocysteine help. Beet compounds, trimethylglycine, those things can help, but most of the time, in addition to doing those things, we need to raise the testosterone levels. And the proof, as they say, the proof's in the pudding. People, men and women, they just feel better. For women, I want a free testosterone between 2 and 4, not 20 or 1,000 total. And I tell them it could be anywhere from 50 to 150. I don't know, maybe even 200. There's a protein in our blood called SHBG, sex hormone binding globulin. It's listed on every blood test. When that's high, it binds to all the testosterone, and there's hardly any left. I see a woman and well, my testosterone's in the normal range. It's 50. Like, well, yeah, your free testosterone is 0.2. How's that working? How does 0 feel? Because that's where they usually are. And to get it to 2 to 4, it's just, a little more fun when you get home with your spouse. When everything's working, I can't lose weight. I go to the gym, but I'm sore, and it doesn't seem like I can, maintain or grow, build any muscle mass. When glucose metabolism, lipid metabolism, muscle metabolism are all optimal from optimal hormones, it works differently. So I understand where you're at, and I've had a number of guys. I got a couple of favorite buddies who come around slowly. They're like, no, I'm not going to do that because if I start, I'll have to do it. I'm like, well, how do you feel? What are you talking about? We're going to do some things to turn it on, not shut your production off. And so when you do exercise, you get the kind of results you should, because you're never too old to build muscle mass if you have adequate hormones. If you don't, it's pretty tough.
So what are some of the biggest misconceptions you see about aging and longevity?
Wow. There's a lot. I think, it's, there's no silver bullet, no magic pill, that's true. But we can do a lot. Nobody's going to live forever. I do know some guys on the left side a bit that feel that science will create immortality. I don't go there. I think there's only been one of those, and I'll leave it at that. Okay. That's my perspective is pretty solid when it comes to the spiritual state. But, you can feel better. You can, quote, live better longer. We want to improve the quality of life, quality of relationships, your overall health. When we do these things, it impacts the immune system. I don't see people getting sick as often. And of course, we do things like harvesting your own stem cells, and I just recorded my podcast today talking about regenerative therapies, platelet-rich plasma, your own stem cells. Is it for everybody or just athletes? It's for everybody. Why wouldn't you harness the healing power of your own body to treat injuries, prevent injuries, boost your immune system? And there's a lot of benefits. We use them for aesthetics. We use it for hair growth. We use it for lines and wrinkles and collagen formation. So the misnomers are, well, nothing, that doesn't work. Nobody's going to live forever. Well, that's true. Nobody's going to live forever that I know. But there are many things we can do to raise the bar, to improve the quality of your life, to, vitality, energy levels, mental focus, brain fire. I sat with one of my golf buddies last night, who's about my age, and he's like, I wrote a check for $60,000 to one of my business partners, and he said, "What are you doing?" He said, "I wrote the balance in the checkbook, not what the check was supposed to be." He's like, "What's going on with me? I'm not thinking straight." And I said, "Look, we need to check things out. there's some interesting research and literature, not only on use of stem cells, things for Alzheimer's, dementia, but on hormone optimization, brain fog. There's lots that potentially may be done, and the sooner the better. When we talk about women, because they have an even higher rate of dementia and Alzheimer's. And if we're just talking about cardiac status, what's the number one killer of women over 50? A heart attack. Why? Because when the estradiol drops, the arteries get stiff and rigid. So if we start early in perimenopause to menopause and maintain optimal levels for the next 10, 20 plus years, the unfortunate thing is some of the OB-GYN academies say use as little as possible for as short a time as possible. Well, great. That's true if it's synthetic hormones, which the World Health Initiative study was done on back in 2000 or 2001. And they proved that it's toxic, it's poison. I won't let a woman touch Premarin or Prempro or synthetic hormones, but natural, derived from horse's urine. Think about it. If we use natural bioidentical hormones for women derived from sweet potatoes, from yams, they exactly match what they made their whole life. So why, if we elevate those levels, keep them where they were in their 20s, restore vibrancy, decrease inflammation, the risk, and the proof is in the numbers, the risk of heart attack and stroke declines significantly. And so why wouldn't we want to do that and set those things aside that we've heard that can't be changed, because it's just not the way it is.
So what are the key hormones that are impacting our aging, and how, you've touched on some of it, how can they be managed effectively?
Well, the key hormones, again, as I say, we got to bake the cake before we ice it. Okay. And so baking the cake to me is restoring for men testosterone, DHEA, growth hormone is reparative. It's highest at 20 and then declines with age. And so we want to restore those levels either by giving, there's different peptides that, which is the buzzword. Oh, I want to take a peptide. And I always say, well, okay, great. Which one? Well, it depends on what is the perceived outcome. So for growth hormone, we use a couple different peptides, and they work well. And or if it's low enough and they're not responding, because not everyone does, then we use human growth hormone. And so for women, estradiol, progesterone, not estrogen and progestin, natural estradiol, natural progesterone restores sleep quality, testosterone in low doses. For women, we can do sublingual lozenges, sometimes a cream or pellet therapy. In fact, I had a gal I was talking with yesterday. She's been with me for over a year. And I'm like, your testosterone is just terrible. Well, I can't remember to take it. I said, well, why don't we just do pellets? She's like, what's that? Well, I thought we talked about everything, but it's a little tic tac we put under the skin. She's like, and I don't have to remember to take those anymore? I'm like, no, you're good for 4 months. 3 times a year, we'll put a little pellet in. She's like, I'll be in next week. Sign me up. That's absolutely. So great. So we are restoring those small amounts of estradiol, testosterone, progesterone, micronized progesterone taken orally at night. It's amazing. You ask women that are going through perimenopause or menopause how they're sleeping, they might hit you. They're not sleeping. They feel terrible. They're up half the night. They just can't get rest that they need. Progesterone's almost like a miracle drug when we give a little bit of progesterone to someone, and small amounts for younger women. It's not the same levels, the same goals as we would have in their 50s or 60s. That I think is the key is managing those levels, knowing where they should be in an optimal range, and then checking them regularly to make sure the therapy is working. It's never just, here's a prescription, I'll see you next year, because anything could happen. We want it to be done safely and effectively.
Yeah, the pellets idea, that was something totally new to me. I did not know about that until I read the book. And that seems just so cool and so easy to do. You don't have to think about doing it. You don't have to, inject yourself on a regular basis. You just
Yeah.
have to remember to go to the doctor 3 times a year.
Right. But with men, it's only twice a year. But as I said, it's not, I have a couple younger guys because they just wouldn't respond for whatever reason. The factory's done. When I say we want the boys to make a little more testosterone, the boys, you're tested. So we
Yeah.
use clomiphene, HCG. But if it doesn't, they don't respond, which happens less than half the time, but it happens sometimes. Then, okay, fine. It's time for testosterone. And the majority are, yeah, let's do the pellets. It sounds great. And it takes a few days to be non-tender and heal up nicely, but it's a little 1/4-inch incision with a Steri-Strip and a waterproof dressing for a week. So it's really easy and it works extremely well.
So are there natural ways to support hormone balance, or do most people require some level of medical intervention?
Yes and no. Yes, there are. For guys that aren't off the couch, you need to get to the gym. You need some cardiovascular fitness. You need to eat. You need to stop smoking. You need to stop poisoning yourself with alcohol. You need to eat healthy, whole foods, real foods you can absorb. Get off the processed crap and cut out all the inflammatory proteins. And exercise is proven to help increase growth hormone levels and testosterone to some degree. In many cases, it's not enough, and we have to either use precursors to turn it on or small amounts of testosterone there. So it's really individual. I can't guess. I can guess when I see people walking down the street and need, absolutely, I know who needs it and who may not, but because things just don't work right when you don't have adequate hormone.
So this seems like a really personalized medical approach to enhancing longevity rather than just kind of a one size fits all. How does somebody who is interested in learning how they can better optimize their hormones, how they go about that? I mean, do they all fly to
Well,
Aspen to your clinic, or what can they do?
I have patients from all over the world, and so if I tell people go to our website aspen-regenerativemedicine.com, or on any of my podcasts, Beyond the Fountain of Youth podcast. There's a link at the bottom to click and schedule a telemedicine visit. We send people to Quest and LabCorp all over the country and internationally to hospital labs, to other things, and then we'll do a consult and see. There are a growing number of specialists that do what I do. It's like interviewing a concierge physician or a new doctor. You want to make sure you're all on the same page, and unfortunately, and I've acquired probably 3 or 4 guys out of the Dallas area who used to go to, quote, a tea clinic. And they unfortunately, it's kind of a mill. It's one size fits all. Here's a bag with syringes for the month. Take this, bye. And I had a younger guy, 38 or 40, that I've known since he was a kid, reach out to me through some of, my clients back there when I lived in North Texas, that went to a clinic, and his testosterone was like 450 something. They wouldn't treat him. Well, it's too high. I said, well, what's your free testosterone? Well, they didn't ask. We tested it. It was 7. Like, look, and so since then he's been on HCG and clomiphene, and he feels, it's only been a few months, but within 6 weeks, I mean, he was like a different person. He felt great, getting results at the gym. He feels like working, getting up and going to work, getting home to play with the kids. Obviously in your 40s, you usually have a family, and you didn't do all this stuff not to have fun with them. I tell people, so yeah, it's fascinating. But how do you do it? Search. Search for someone. We're happy to answer questions and in some cases help. You can go to things like the American Academy of Anti-Aging and Regenerative Medicine and look at their website in their provider network for people that are board certified in anti-aging and regenerative medicine. And so that's a good starting place, I think.
Yeah, because you'd almost have to have somebody local if you're going to do the pellets approach.
Yeah, it's a little hard to do when we're long distance, but I have people that fly in from Michigan and Texas. They either meet me down in my Denver office or they want to come to Aspen in the summer and fly fish or go hiking anyway. And I'm like, fine, one of my boys is a fishing guide. We'll hook you up. And, there's worse places to come. And fortunately, a lot of it doesn't have to be pellets. And I tell people that that's going to be a setback, particularly women. We have to do it every 4 months, and they're in California or they're wherever. I'm like, look, we'll start with sublingual lozenges at bedtime. If that doesn't work, there's creams that we can apply that usually provide pretty good blood levels. And if you're sick of it all, then fine, we'll do pellets, but you got to come see me. And some have switched. It's like, well, I'm not going to be back this summer after all, so let's get back on the lozenges, and then I'll get pellets next winter when I'm like, okay, whatever. We can make it all work. It's a matter of testing, trial and error, getting the doses right so that people feel their best. And that's the key, is that it's tested regularly and that somebody really understands how to optimize hormones.
So you probably can't teach me to do my own pellet injections, right?
And no, but we can put them in and follow up, and you go to the lab and we'll have a visit similar to this to see how things look.
So what factors do you consider when developing a customized longevity plan for a patient?
Well, one, what's their interest level? There's so much, and it's hard for me. I spend at least an hour, sometimes hour and a half with a new patient trying to go through everything. And I still can't talk about everything. We do high dose ozone, EBO2. We haven't mentioned, and there's a chapter in my book on what we call senolytic drugs that help rid your body of zombie cells. Well, what is that? Well, they're cells that are kind of done dividing, they're hanging out, they're a burden on the system, and we can get rid of that with rapamycin, quercetin, and dasatinib, things that we take under prescribed protocols to help ease that load, and they do produce results. So, but it's I like, as I said, first we're going to bake the cake. We're going to do basic hormone management. I'm going to recommend 5 to 8 vitamins from my vitamin line that you're not taking that definitely make an impact. NAD plus is the most plentiful coenzyme in your body. Most people need that. It comes in a flavorful, rapid dissolve tablet. Nitric oxide as we get older, which is very important, not only for blood pressure control and heart health and brain health, but erectile function. Cialis and Viagra don't work if you don't have enough nitric oxide in your body. And so it's a simple tablet that you just pop under your tongue and suck on once a day. So, I like to look at those things, and then we consider, hey, by the way, your IGF-1, your growth hormone level is 89. It should be 200 to 250. Let's do something about it. And so could be peptides initially, could be human growth hormone. And we just, it's just like being a detective. We're always looking for things that we can, fine tune in order to help someone feel.
So going back to that Corvette of yours, it's like,
Exactly.
tweaking the engine and just getting
Yeah,
it really firing on all cylinders. So
sure.
there's specific biomarkers that people should monitor for optimal aging?
Well, sure. I do what I call my comprehensive panel with every new patient, and then once a year. And I do it, I have some that like it done every time, but it's a little more costly. In a hospital lab, it's $3,000. If insurance covers it, great. If not, they get paid about $650, and that's what I charge for that. All the other panels are at least half that price, which are done quarterly. But the comprehensive panel, we want to look at C-reactive, the usual things any doctor: blood count, chemistries, kidney function, liver function, cholesterol. I add apolipoprotein B. Some do ApoA. We want to make sure there's not high number, for you of bad cholesterol, inflammation markers that affect your cardiac state, C-reactive protein and homocysteine, which I mentioned before. Cortisol, stress hormone, having high stress and high cortisol levels are inversely related to growth hormone and testosterone. suppress it. And so we want people to be getting good sleep, exercising, dealing with stress, eating healthy. What else? Obviously, markers like PSA for prostate. I do a CA-125, a blood marker for ovarian cancer for women once a year. CEA titer is a blood marker for colon cancer. And we do the Gallery test, which is screening for 50 cancers. We do micronutrient testing to make sure, am I absorbing what I'm taking? And then I do fit gut testing through KBMO diagnostics. It tests reactive, not food allergy, but inflammation, reactivity to 176 different foods, plus 4 major components that cause leaky gut syndrome, which that in itself can cause problems. And so I have a product in our office we call Gut Health. It's 3 grams of glutamine, which is important for leaky gut syndrome, and some botanicals in it that also help decrease inflammation. So there's a number of things that we like to look at to start someone, look at it annually. I didn't even mention, the hemoglobin A1C, a 60-day blood sugar average. As it used to be, anything above 6, you were pre-diabetic or diabetic, and then it went to 6, and then it was 5.9. Now 5.7 is too high. For longevity, we want it to be 5.4 or less. And so the lower your overall blood sugar. You asked about, cholesterol, and in one of my recent podcasts, I say, look, cholesterol alone isn't going to kill anybody. It is what's going on, how much inflammation do you have? If there's a lot of inflammation and a lot of fat in your blood, then your body wants to get rid of that inflammation. It wants to heal it. And so what does it do? It lays down plaque. So 1, we got to reduce inflammation. 2, we don't want, and we do a test on glycoproteins called the glycan age test, that based on the amount of glycoproteins in your body, it can tell us your biologic versus chronologic age, the status of your immune system, a number of things. But we want that sugar to be as low as possible. If you have high cholesterol, but low blood sugar, low inflammation markers, the cholesterol alone, the old days of everyone should be on a statin or it should be in the water supply. We know that that's not really the best strategy. What's happening? Have you had a CT calcium score? Have we looked at the carotid arteries to make sure that you haven't started accumulating? And so there's a number of markers that we look at annually or sooner if they're off, and we want to see how they change because they affect the big picture, the longevity, a lot.
What about, I've heard a lot of recent research talking about the size of the cholesterol molecules. Do you do any testing with that? I have not heard of anybody doing any testing. I don't know how much BF
like LDL-C, and it's hard to keep up with all of it. And yes, we would like our fats as low as possible, but sometimes it's a hereditary issue. I have patients with their total cholesterol in the high 200s, LDL above 150, and those we have to look at more carefully. So we would order what we call lipoprotein electrophoresis to look at all the particles. There's an interesting test that takes it even further from the Cleveland Heart Lab that shows components of plaque and cell membrane that we can see. If they're high, then we have more to worry about, because if there isn't already plaque, you're going to form more, and we want to help lower that. And so it's individual, but with all of our new concierge patients, I do the Cleveland Heart Test Lab, sit down and look at myeloperoxidase, compounds called ADMA, things that, are in the artery wall, and plaque that we don't want in high levels. We want it as low as possible. We want to make sure that omega fatty acid numbers are up. And so that's where supplementation can, homocysteine.
So we talked before we started recording about, I just had my calcium CT scan, and my cholesterol is high. I think it's in the low 300s for the total cholesterol. My HDL is 72, and my score, and I forget the name of the score, but it's a 20. It's like on a scale
Mhm.
of, what is it, 0 to 200, 400, something like that, 500. I forget the name of that scale, but I fell 20 on that scale, which I guess 10 to 100 is considered to be mild calcification of the arteries, mild risk for heart disease. And my doctor immediately wants me to go on statins. How would you
Well,
approach my situation?
we mentioned earlier, I would look at a lot of things. What can you do? What else is going on? What is your 60-day blood sugar? Is it borderline? Do you need to change your diet, trim some body weight, get rid of sugar, lower those numbers? What's your C-reactive protein and homocysteine? If everything's normal, you don't have a lot of sugar, you don't have a lot of inflammation, cholesterol is much less of a factor. And I use things like red yeast rice, supplement on my website I call Cholesterol Plus. That's bergamot and another compound that naturally, those two things together can help stabilize, blood fats and glucose. And then watching diet. Stop using seed oils. I asked at something to eat, was going to get some fries the other day, and it's cooked with canola oil. And I was a little rough on them. I'm like, well, why don't you just use motor oil? Okay. Anyways, it's beef tallow, avocado oil, olive oil. There's other choices of healthy fats, and which is a whole other topic. There's people out there with a lot more information about that I pay attention to because I'm trying to do the best I can. Well, I'd like to stick around. My dad turned 100 on Thanksgiving,
Oh,
and
wow.
we
That's
had a
awesome.
huge celebration. And my number's 120.
That's my goal too. So I got to work
As
on
long as
those
I
things.
feel good and can hit the golf ball,
Right.
and maybe ski once.
My diet's pretty good. I do, the main oils that I'll have are olive oil, avocado, um, coconut oil. I've started putting flaxseed in my coffee and in my oatmeal. I might need to I don't know where you stand with the oatmeal and stuff like that as a grain, and it's organic. It's
I
the
know.
better kinds of
I
Bob's Red
I
Mill, but
I watch what happens with my blood sugar after I have oatmeal because my grandfather lived to a ripe old age, even though he smoked 2 packs a day, but eating oatmeal every day. I had oat groats today, and that whole husk oats, and we started about 3 hours before we get up in a little mini crock pot, and I love that. That I like a lot, but it does, affect my blood sugar more. I don't eat that too often.
I'm trying to think of what else. I mean, I exercise regularly. I need to get a little bit more. This podcast has kind of gotten in the way of exercising as much as at least doing the cardio. I do the weights a bit more. That's been much more of a focus. I think for me, sleep has been a big issue.
Mm.
And I'm trying to get my head around that because I monitor my sleep. I'll sleep about 7.1 hours on average a night, but my sleep scores, kind of monitoring with a Garmin, they've been better. We had, I'm drawing a blank on Dr. Lewis's first name, but he's done a lot of research with Alzheimer's and using polysaccharides from aloe. And I've been trying his product, and actually trying that has actually given me better sleep scores, and I'm getting better overall rest from that. Still not
You
quite
snore?
recovering, not restoring. I don't know. I mean, yes, everybody says I snore. So I got a sleep study scheduled, and
Good.
so I want to see if it's going to be sleep
Yeah,
apnea.
sleep apnea is a big deal, and
Yeah.
it you wake up and you feel like you don't hit deep REM sleep, whether it's 7 hours or not. If you're not hitting the right levels, you're really not in a reparative state, and so it's grossly underdiagnosed. I've used a CPAP machine for 20 years, and you don't have to be obese to have sleep apnea. I
Right.
started in 2004. I snored loud. At our deer camp, the walls would move. And in fact, the first time I used a CPAP, my brother couldn't sleep. He's like, "It's too quiet in here." I'm like, well, hey, I got to do what I got to do now. He gets to use
Yeah.
one too. But it is a big deal, as I tell people. you only get sudden death once.
Right.
So let's not go there. And it's a big deal. When I used to, in a former life, when I did other kinds of things, workman's comp and sports medicine, and I used to treat a lot of, do DOT physicals and truck drivers. And if they snored or scored wrong on the sleep scale, they didn't get a license until they always made them mad. I'm like, hey, I can't pass you because, you fall asleep in an 18-wheeler, you take a family out. And I know of a close family friend, a kid I took care of in high school football, a lineman, big kid, and he had sleep apnea and he fell asleep driving a truck and he was killed and 5 other people in a car, a whole family. So I take it seriously. I like that's tough. And it's amazing how you feel when it's been treated. And it's simple. You put a little CPAP on and, I call it sleeping with my snorkel gear. And you just feel better. Of course, as we get older, seems like we get more rest, and it's 6 hours, 7 hours, or we don't need 8 or 10 hours sleep. In fact, if you sleep 10 hours, you probably won't be able to get out of bed. It's just right. Once you hit that certain number, you just want to stay there, and it can't be productive. But that's something important that should be looked at. Melatonin declines with age. I have most patients. I'm like, it doesn't matter if it knocks you out. You don't have enough. You need to take 5 milligrams or 10 milligrams at night, sometimes a little vitamin B6, which adds a little sedation. So, there's a number of things, but sleep is important.
Yeah, I feel like if I don't get my sleep in order, then I'm not going to, I'm not losing any weight. I can diet out a storm and I'm not going to lose any weight. I need to get all that stuff in order. And if I do that, then, the refinement might come from some hormone therapy and optimization and that kind of stuff. Statins are just going to put a Band-Aid on a problem that needs to be fixed. And so I really want to fix the problem first before I start worrying about treating the symptom.
Well, good. I've enjoyed this.
Yeah.
Awesome.
I got a list of questions I haven't asked you yet, but I know we're like at the hour point, and I know you are a busy, busy man, but
well, I have to be on I got a Zoom meeting 10 minutes ago.
Okay. One last question, and I think this is an important one. Where can our listeners find your book, Beyond the Fountain of Youth, and learn more about your work? I think you mentioned a website. If you could kind of restate that again, and we'll make sure we get to.
So this is a bestseller on Amazon now. So you can just go to Amazon, put in Beyond the Fountain of Youth or my name, and get a copy. It's available. The audiobook was launched, I think, yesterday. We have an ebook as well. If you want to learn more, have questions, or want to schedule a telemedicine visit, just go to aspen-regenerativemedicine.com, my website, and click on Contact Us and or call us. So happy to answer questions and try to help get more people on the right track.
All right. Well, I appreciate your time today, and I know I probably used too much of it, but I really enjoyed this. I still have more questions for you, so maybe we'll have to have you back on again to just kind of dive into these a little bit deeper. But yeah, just thank you, Dr. Gershon, and just keep aging well. Thank you for listening. I hope you benefited from today's podcast, and until next time, keep aging well.